Day one, pre-op, heading to Brady's to get our checkup, or Isaiah's checkup.
Sprinkling.
It's sprinkling. We're on time.
On time.
And we'll keep you guys updated.
I'm trying to get over to the parking garage for Sharp. We just parked in the wrong parking garage.
Oh, go and get that. Okay.
Buddy just got his blood drawn. Didn't cry?
Okay.
Now we're on to cardiology.
Yeah, that's what it says on the system. Okay.
How is Buddy?
How are you, Betty? You did awesome during the blood draw. You didn't even squirm. You were so calm. Huh. But you're hungry now.
Inside the hospital, next to cardiology, there's a McDonald's. Brings good business. Infection. What do you think about the surgery? Oh, okay. Are you nervous? Are you nervous?
Are you nervous for your surgery?
Oh. Okay.
What you can tell the doctor? Huh? What you can tell the doctor?
EKG is done.
He's holding his papers.
EKG is done. On to cardiology, the doctors.
Yeah, we're going to see the doctors right now.
And Lasix takes place.
He doesn't take that anymore.
Okay.
He stopped it, I think, when we got the diagnosis for TOI. So it was back in December.
Okay. Tetralogy of Fallot. I'm sure you've heard them use that term before. So the tetralogy of Fallot consists of 4 different. So if you look over here, this is kind of a cartoon drawing of a normal heart, what the 3 of us have. Here, this vessel over here is called the vena cava. Down here is the inferior vena cava and the superior vena cava. And all of your blood that's deoxygenated because it dropped off the oxygen in all your tissues and your brain and in your limbs comes back to the heart through this vessel. So all the blood from your arms and your brain come back through here, and then your legs and your lower body comes back up through the inferior vena cava. Comes into the right side of the heart and is pumped through this valve here called the tricuspid valve in the right side into the right ventricle. So there's 4 chambers in the heart. You have the right atrium, the right ventricle, and the left atrium and the left ventricle. So this unoxygenated blood comes in through the right side of the heart and then gets pumped out by the right ventricle into the pulmonary artery. This here is the pulmonary artery. And this is what we call the pulmonary valve here. So this artery feeds your right and left lung. So basically there's a lung over here and a lung over here, and this artery is going to that lung, and the blood there through here goes into the lung, picks up oxygen, and then comes back from the lung through these little vessels here. So now it's oxygenated, or red blood, comes back through these veins here and into the left side of the heart. So the blood is now oxygenated, comes into the left atrium, gets pumped through this valve here, which is the mitral valve. And then the left ventricle here, which has to be nice and strong because it has to pump blood to your entire body, pumps it through the aortic valve here and out into the aorta. And then the aorta feeds your upper body, your brain, and then it also, you can't see it, but it comes down back behind the heart and then feeds the lower part of your body and your other organs that are below your heart as well. So that's the normal heart, the normal structure, the normal flow. There's no mixing of the blood in the normal heart. The oxygenated blood is kept separate from the unoxygenated blood. And this cycle just continues. So in tetralogy of Fallot, there's usually 4 things. So the first is pulmonary stenosis. So remember, this is the pulmonary valve here. So there's usually some extra tissue in here making this valve what we call stenotic, or hard to get blood to go through it. So that stenosis there is what causes this right ventricular hypertrophy, because there's a blockage there. This ventricle has to work harder to get blood to come out through here. So that muscle gets bigger because it's having to work harder. So that's right ventricular hypertrophy is the second thing. The third thing is there's a hole between the right side and the left side of the heart. There's what's called, if you've heard them use the term, a ventricular septal defect, and that's the name of the hole that allows blood to flow, to cross over here, where in the normal heart there's no hole here and there's no crossing of the blood. So that's VSD, or the hole. And then the fourth thing that happens in most tetralogies of flow is this aorta that's usually just connected to the left ventricle kind of overrides both ventricles. So there's blood that's mixing here and coming out through the aorta. Okay, so that's called an overriding aorta. Okay, so that's basically tetralogy of flow. So the things that we do to fix tetralogy of flow, the surgeon will go in and resect some of the stenosis here, or repair it, and fix this hole here. So in doing there's 4 things wrong, but in doing those 2 corrections, you essentially fix the defect.
Oh, wow,
Okay.
Drains back to the heart in the veins. Okay, it's blue because all the oxygen has been removed from it, or most of it.
Okay.
And so all the veins kind of coalesce into the 2 largest veins in the body, the superior vena cava and inferior vena cava. So then all the blue blood enters the right side of the heart, okay, to the right atrium, then the right ventricle, and then the right ventricle pumps the blood out the pulmonary artery to the lungs, where it gets oxygenated. So once there's oxygen in the blood actually. But many patients with tetralogy of flow are blue, but we'll get into that.
Okay.
And we call it blue, they're not really blue. It's sort of dark maroon color. But if you compare it to the bright red blood of the blood that carries full, complement of oxygen, it looks blue because that blood is so bright red. Okay, but anyway, so the blue blood comes back to the right side of the heart. And the right ventricle pumps the blood out the pulmonary artery.
You can get there from inside and I'll show you.
Oh, okay.
This is the emergency room.
This is the main entrance where now it's also food. Right.
So I'll get into the visitor thing.
Oh,
surgery comes here. This is where it's going to be. Another thing, if you can go this way too. This hallway, and it's the same thing on the second floor, takes you to that new building where we were just at. This is like a walkway.
Oh, I see.
So if you take this over, like even tomorrow, if you're, if you want.
So this is our waiting area.
And then this is where Dr. Levine is also room, but again, this would be a double, and this is like where you'd be after, you know, a few days in the ICU part.
Oh, okay.
So private, I mean, the private room is pretty much this alone versus
Right.
the, you know, double.
Right.
These chairs pull out
Oh, so that's like the bed
Yeah.
where you'd sleep.
into
Oh,
like a
I see.
sleeper chair.
Okay.